Welcome to We're on ECMO, a new video series for the ECMO community where I ask an ECMO question to an ECMO expert and get a 2 to 3 minute response. Joining us today is ECMO Advantage Education Coordinator Beth Clark. Beth, thanks for joining us.
Of course.
And today's question is, when a patient is desatting or desaturating, what is the first thing you check?
So the first thing I'm going to do is look at the patient. So I'm going to look at a couple things and I'm going to say them, and it kind of sounds like it would take a decent amount of time, but we tend to assess patients pretty quickly, so it should just take a couple seconds. So first I'm going to look at their activity. Are they sitting at the edge of the bed doing therapy with PT? Or are they still sedated? So that kind of tells me maybe a reason why they could be desatting. I'm going to look at their color. Are they dusky? Or are they dusky just in a certain portion? Is just their head and neck dusky? Or their whole body is dusky? And I want to look at their perfusion as well. Are they mottled and pale looking? So looking at them really quickly. The next thing I'm going to look is at my ECMO pump. What is my pump flow? Is it the same as what it has been, or has it decreased? Look at all my pressures. Is my venous line pressure decreased? Look at my pre and post-ox pressures. Are they higher, lower? What have they done? And as well as my SpO2, looking at that. And if my patient is on VV ECMO, I want to look at my SpO2 and then my patient sat, looking and seeing if they're recirculating. So I definitely want that difference to be at least 10 points different, with my patient saturations being higher. So I'm going to look at all those things really quickly. And then the next thing I'm going to do really depends on what form of support I'm on. So if they're on VV ECMO and they're desaturating and my SpO2 is increasing, I'm going to try to figure out why they're recirculating. So are they recirculating because we just turned them and their cannula is malpositioned? Have we been diuresing them and their SpO2 is increased because they're hypovolemic? Is it because I just increased my pump flow? My pump flow is too high for that patient? Or is it because their native cardiac output has decreased? So I'm going to look at those for those reasons. Next I'm going to do is look at their patient monitor. What is their heart rate, their blood pressure? Have those changed dramatically? What is their CVP? I'd mentioned potentially being hypovolemic. Their end tidal. I'm looking at all those things. And then last I'm going to look at their ventilator. Are they very tachypnic? Do they look air hungry? All those things I'm going to look at to figure out what the cause of my problem is so that I can help fix it.
Awesome. I think that's probably a really thorough, excellent answer. Hopefully that'll help somebody out in the field. So I just want to thank everybody for joining us today. It's quick, it's simple, and I appreciate you being here for We're on ECMO. I hope that you'll share this content with others interested in learning about ECMO. And if you have questions that you would like to see answered by experts, that you'll email me, Neil, Neil, at ECMOadvantage.com. See you next time.